Moving on to our next interesting session. So, we will dive into the fascinating world of hydrogen water. We all hear about how important water is for our body, but then again, we also hear about different kinds of water. So, today we will talk about hydrogen water. Recently, it has gained significant attention as unique wellness trend, but then it is backed by a lot of scientific research highlighting its antioxidant, anti-inflammatory, and cellular protective properties. As we know, hydrogen is one of the simplest and most abundant elements in the universe, and by addressing oxidative stress and inflammation, which are the two key drivers of chronic disease and aging, hydrogen water offers exciting possibilities for improving brain health, cardiovascular function, metabolic balance, and overall vitality. To enlighten us on this topic, I have Mr. Praveen, Mr. Praveen Angadi. Let me just bring him on the screen. Mr. Praveen, yeah.
Hi.
Welcome, welcome, Praveen. Praveen is a health coach, and I had the opportunity to work with him over the last few years. His knowledge on innovative tools that can help in improving overall patient outcome is amazing. He has worked on scalar detox, and with that modality, we have seen amazing improvements in our clients, whether it be it with chronic conditions, detoxification of heavy metals, and even in children on the spectrum. And another area that he's working on is hydrogen water. And we will hear a lot more from him today. So over to you, Praveen.
Hi. Everyone.
Yes, we can see your screen.
Yeah. Hi, everyone. Uh, we'll talk about hydrogen water today. This is a new modality which has come into a picture as of recently. Historically, it has been used from a very long time. Like from 1960s, it has been used in Japan. Although not knowing what exactly was giving the benefits, but they did electrolysis of water and later on found in like early 2000s, like around 2005, 2006, they figured out that what all the benefits that were happening were because of the hydrogen gas that was present in the water. So I'll take you through some slides. Since we have very less time, I'll just try and cover as much as possible. And we'll try to understand how hydrogen water or hydrogen, molecular hydrogen can help us in various disease models and especially in cancer. Um, Okay. So first we'll try to understand what is hydrogen water. Hydrogen water is nothing but in plain water you diffuse molecular hydrogen. Hydrogen is a gas. It is the smallest element we know, and it is very easily diffusible in water. So we can just diffuse it in water and drink that water. So as soon as you consume that water, it basically the hydrogen goes inside and starts getting absorbed, and it does its work. There are different ways of administering hydrogen. One important way is hydrogen water. The other one is inhalation of hydrogen gas. Here we will concentrate on hydrogen water, and everything similar things apply to hydrogen gas as well. Everything that applies in water also apply in case when if you are inhaling hydrogen gas. Um, but consuming hydrogen water has some more benefits is what they have observed because it directly goes and starts affecting the gut microbiome. Uh, so we'll try to understand how hydrogen is produced first. So you might know about this electrolysis process. So if you just put water and if there's an electrolyte, like put two rods, one becomes a cathode and one becomes an anode. And if you start electricity, what happens is H2O splits into O2 and H plus. So H2O splits into O2 and also a hydrogen gas. Hydrogen gas goes onto the negative side, and the oxygen gas goes onto the positive side. There are machines which filter out this oxygen and throw the oxygen out, and basically only keep hydrogen gas inside this water. So we have technology now where only hydrogen can be dissolved into the water, making it a very rich source of hydrogen in the water. So let's try to understand what are the advantages of hydrogen. So you might have know already about antioxidants, wherein so why are antioxidants necessary for human being? I'll just give a little bit of background, and we'll try to understand how hydrogen water can help in this. So any process in the body, may it be breathing, may it be any metabolic activity, may it be production of any amino acid or anything, it has to go through an oxidative process. If I breathe, exchange of oxygen into the blood also is an oxidative process. When in the citric acid cycle, a production of energy which eventually produces the electrons is also an oxidative process. Oxidative processes are very necessary for the body. But as a byproduct, in some processes there is a reactive oxidative species produced. So to neutralize them, we generally take antioxidants. The body produces its endogenous antioxidants like glutathione, wherein through NRF2 pathways, and there are other antioxidants in the body. And since human beings cannot produce vitamin C, they consume vitamin C, and that gives the necessary electrons or necessary antioxidants to neutralize these oxidative free radicals, especially like something like a hydroxyl radical or a peroxynitrate radicals. In the body, for any processes to happen, we need a sufficient amount of electrons. Only then, so there's something called as redox potential, because of which a body can basically do the metabolic processes. If it wants to, say, if it wants to regenerate a particular cell, whatever oxidation is required for that, body will only try to put forward if the necessary electrons are present. So an antioxidant availability is a necessity if at all oxidative process has to take place. So in cancer especially, what happens is the necessary oxygen, like the electrons get reduced, as Dr. Lodi had said before. Like there is an acupuncture meridian, and in each acupuncture meridian, they are nothing but the transporters of electrons, and those electrons get transported to various organs. And once these electrons are present, the body has the capability to either regenerate or produce the metabolic byproducts. It may be stomach acid, it may be enzyme or anything. So you need these antioxidants. So that's when an oxidative process can take place, and the necessary functions of the body happen. So this is called as a redox potential. This is the most necessary thing for our body to be in balance and do its necessary work. And these oxidative, and apart from this, the oxidative stress which is caused by these free radicals damage a lot of things in the body. So for that process, we need to neutralize these reactive oxidative species, and for that also you need antioxidants. So these are the two ways the antioxidants are used in the body. So now we'll come to molecular hydrogen. Molecular hydrogen is a very small molecule. It is the smallest molecule in the universe, and it acts as a free radical. It may not directly go and react, but it's a very powerful signaling molecule which starts neutralizing these highly reactive oxidative species like hydroxyl radical and peroxynitrate radicals. And it only mitigates oxidative stress. It does not mitigate the oxidation that is needed for the body. As I said, like even if we breathe, there is an oxidation process. Any metabolic process that happens in the body is an oxidative process, but it's not an oxidative stress. So hydrogen molecule is very selective. It only mitigates the oxidative stress. It does not mitigate the oxidation potential that is necessary for the body. So in this process, it prevents the cellular damage. By neutralizing these potent oxidants, H2 helps in preventing the cellular damage that can lead to various diseases, including neurodegenerative diseases, cancer, cardiovascular disease, and using arthritis, diabetes, so many of these. Any metabolic syndromes. They have oxidation involved with it, and this will help in preventing the cellular damage because of the production of the reactive oxidative species. And also, if at all you overconsume antioxidant, there can be an issue. Here, there cannot be overconsumption of hydrogen because it will only neutralize the reactive oxidative species. It will only, but it is not the same with vitamin C or high consumption of any other antioxidant. So that's a big advantage we get. It's a selective targeting. Uh, as I said, it's a smallest antioxidant, so it can penetrate everywhere. It can penetrate the cell membranes and go into the mitochondria, where the Krebs cycle happens, and it can neutralize any oxidative stress that is happening over there. Since it's a small molecule, as soon as you drink it, there's a rapid distribution that happens. It can pass through anywhere. It can pass through the blood-brain barrier. It can pass through like any, as I said, the cellular membrane and everything. Because of this process, it can have a huge protection for the mitochondria. It has a mitochondrial protection associated with it. And any disease like Alzheimer's or maybe dementia, they are all associated with higher glutamate excitotoxicity, and which results in an oxidative stress. So when if you drink hydrogen water, hydrogen directly goes to the brain because it can cross the blood-brain barrier. There are very few which can cross the blood-brain barrier, and it goes there and starts neutralizing any oxidative stress that is happening in the body. Because there's continuous glutamate excitotoxicity that is happening because of the imbalance in the neurotransmitters and other things. And also, it has excellent gene expression. So apart from like one of the main ways this hydrogen molecule acts is by signaling. So as soon as you drink, it can signal NRF2 pathway, which can eventually help in production of glutathione. So in that process, glutathione is produced and an antioxidant is available to the body for any like for a redox potential increasing or for neutralizing any reactive oxidative species. So as like it activates almost up to 200 cytoprotective genes. It upregulates powerful antioxidants such as catalase, glutathione, cytochrome P450, which is one of the main antioxidants produced in the liver. And liver, is one of the main organs of the body for detoxification and processing of everything we eat or everything. And it helps in maintaining the healthy antioxidant and free radical levels. It is not going to do anything if the body is already in a homeostasis level. If at all it's working properly, if you drink hydrogen water, it's not going to do much. But if at all even a little bit of imbalance is there in the body, it is going to basically correct that because it has this signaling to almost, as I said, 200 cytoprotective genes. This is in nutshell, we can say molecular hydrogen regulates signaling pathways and gene expression via modulating the expression activities of various biomolecules as well as several marker RNAs, which may account for the therapeutic effects of various things like anti-reperfusion injury, anti-radiation injury, anti-inflammation, anti-metabolic disorders, anti-allergy, anti-dementia, anti-aging, and many more. So it's one molecule which has wide range of benefits. Let's see how it can help in cancer health. So as I said, cancer, we understand like cancer happens because of there's a cycle to it wherein there's a reduction of antioxidants in the body. Like there may be any damage to the body because of there are few root causes we can think of. May be toxins, as Dr. Lodi was saying. It may be toxins. It may be scars on the acupuncture meridians. It may be dental infections. It may be pathogens like parasites, fungus, bacteria, or anything. So what happens is we cannot transport electrons because of this, and electrons is nothing but antioxidants, because of which there is lowering in the voltage of those organs, and the lowering in the voltage of organs leads to lowering of the oxygen in the environment. Lowering of the oxygen leads to various lowering in the oxygen leads to fungal infections, because like lowering in the oxygen means it's a death process. So when we die, the oxygen in the body goes down, and that's when the various pathogens, like fungus, comes up. That's a natural death process. So lowering of the electrons results in lowering of oxygen. Lowering of oxygen results in uh, our latent fungus and viruses to come up. It reduces the immune system. Then there is an attack by. Then we are not able to detoxify our toxins. So it's a continuous, like it's a cascade effects which results in cancer. There is more to it, but yeah, in nutshell, this is what is happening. So as soon as you start drinking hydrogen, the necessary electrons that are needed to neutralize these damaging effects of these the oxidative stresses starts happening, and you start getting this proper things. Like I'll explain few things which happen because of the taking of hydrogen water. So it may help in reducing oxidative stress, like we have till now gone through it, wherein cancer cells thrive in oxidative stress. It's nothing but low electron stress, low electron environment. So as soon as you drink hydrogen water, it increases the necessary redox potential, and you are able to basically regenerate a new cell which requires a higher potential, higher voltage. May support in elevating chemotherapy side effects. Like we'll talk about this going forward. As I said, it has huge anti-inflammatory effects. So it reduces oxidative stress. It it downregulates pro-inflammatory cytokines such as IL-6, IL-1A, TNF alpha. It upregulates anti-inflammatory cytokines like IL-10 and interleukin 10, interleukin 22. It promotes a balanced immune response to reduce tissue damage caused by excessive inflammation. So this overall slows down tumor progression. So as soon as you give the necessary environment for the body, the growth needed for like the environment needed for the growth of tumor subsides, and you basically the progressions reduces, and you do other things in the meantime for like reducing the tumor. It may, like studies have shown that it may also enhance the chemotherapy efficacy. Where they have seen that consuming hydrogen water on a regular basis, it can increase the chemotherapy efficacy. One of the biggest advantages of hydrogen water is it supports gut health. What it does is, as soon as the water goes inside, it creates an environment for healthy gut microbiome to thrive. There is already hydrogen produced in our microbiome, but external consumption of hydrogen is seen to help create an environment which is very good for healthy gut microbiome to flourish. It also regulates hunger hormone, ghrelin. So if you're into intermittent fasting, or if you want to do water fasting, the ghrelin hormone is regulated in such a manner that you won't feel that hunger, which you generally do if you are consuming normal water. And that helps. So, like intermittent fasting helps in autophagy. After 2-3 days of water fasting or something, there is a process which kicks in, which starts killing the bad cells, like the dead cells, and there's autophagy, and that helps in cancer reduction and generally overall health. It helps in detoxification and liver health. So as soon as it starts helping the liver function, the body is able to detoxify more. As we like, there's a hormone which helps in liver, which I spoke about. I think so. It's T450, T450, which is one of the major signal thing which is there in liver to detoxify. So as soon as you consume hydrogen water, it starts reducing those oxidative stress molecules, and it helps in liver to get better, and that in turn helps in detoxification. In recent research, including 60 individuals with hepatitis B, hydrogen water added to routine treatment decreased the oxidative stress. S2 regulates the gene associated with overall liver health. It may be cholesterol regulation, antioxidant defense, or cellular energy production, detoxification, liver metabolism, and also cardiovascular health. So basically regulates all the things that are in liver. So in the with that, it starts. I mean, it helps in detoxification. And once the liver is good, the body can do much more things which is not able to do before. And also, this is something in which it may help for people with liver cirrhosis. Studies have shown that it may help to some extent, or at least prevent liver cirrhosis, because studies have shown that it might prevent liver scarring in mice. So, drinking that, if you are like any alcoholic liver cirrhosis or in general liver cirrhosis, drinking hydrogen water can a little bit of liver scarring can go, but it can definitely prevent the liver scarring. It can, as I said, it can reduce radiation therapy side effects, reduce oxidative stress caused by these therapies. Like it minimizes fatigue, hair loss, skin problems, nausea, headaches, etc. And it protects healthy cells from collateral damage without reducing the efficacy of cancer treatment. Because it is not going to, like, radiation is an oxidative process. So once there is an oxidative process, if there is any damage because of them, you need antioxidants. If you consume excess antioxidants, there is a chance of neutralizing the effects of radiation. So that's why when you take like when you are on cancer therapy, if you are taking chemotherapy, they tell you not to take something like vitamin C. High dose vitamin C has some other effect wherein it goes and converts to hydrogen peroxide, so it becomes an oxidative therapy. But any antioxidants like a glutathione or low dose vitamin C are generally avoided because it neutralizes the oxidative effects of the radiation therapy. So here, once you consume hydrogen water, it's not going to stop anything that is helpful for the body, but only the collateral damage that happens because of reactive oxidative species that are produced, it neutralizes them. And one investigation involving 49 patients with liver cancer found that consuming hydrogen-rich water for 6 weeks during radiation therapy enhanced the quality of life. As I said, promotion of autophagy. Molecular hydrogen promotes autophagy by signaling various needed pathways. By enhancing autophagy, hydrogen can help elevate stress induced by cellular damage and support recovery from various diseases, including cancer. It's not just related to cancer, but body must eliminate whatever is dead. So the body has, like, if you know about a body, it regenerates. Every different organs has a regeneration cycle. Like liver has, I think so, 3 months. Nervous system has 1 year. Our cornea has 24 hours. Our gut lining has around 5 days. So whatever new old cells are there, they are pushed out, and there is a new cell that is produced, and it replaces. But body eliminates these old cells. So if the body is not able to eliminate these old cells, then we have an issue because they're just dead cells roaming around. Similar to how dead bacteria like a lipopolysaccharides, these also cause a little bit of issue because they're just dead cells. So hydrogen water promotes this autophagy and modulation of various cellular signaling pathways, as we have spoken before. It produces almost 200 cytoprotective signaling. It triggers signaling pathways. It may be NRF2 pathway, as I said, catalase, or glutathione, GSH pathway, or oxygenase. So this is a wonderful thing to have. And again, cellular protection, as we have spoken again and again. It preserves mitochondrial function, ensuring energy production. As we know, mitochondria is the heart, is the main energy source. So as soon as we eat glucose or fat, it goes into mitochondria, and there's a Krebs cycle which breaks down these things and produces the necessary ATP, ADP, which is the energy producing. And then there is electrons available. There is electron chain transport which takes it throughout the body. So mitochondria is very necessary, and hydrogen molecule, because of its size, it can enter the mitochondria, and whatever there is a damage, if it happens during this process, it can neutralize. And it also shields DNA from oxidative damage. In cancer, because of this, there is a lot of mutation, and we face further problems. So consuming hydrogen water can prevent this oxidative damage, and it can help maintain this genomic stability. And it enhances cellular repair mechanisms by supporting enzymatic activities crucial for DNA repair and cellular. And this is done by various signaling pathways. And it also improves membrane integrity because it can stop the oxidative stress. And because of this, cells from external stressors and it's safeguarded from these external stresses, and there is proper nutrient exchange because of that. So we'll just, there's a dosage, recommended dosage, but there is at least to drink this much, at least 1 to 2 liters per day. And there's a minimum concentration that is needed. It's 0.6 ppm, but at least it's best to have at least 1 ppm. This is according to International Hydrogen Association, where they have recommended at least 0.6 ppm as the concentration, but we would want it to be at least 1 ppm. And during cancer treatment, we need to at least drink 2 liters. The more the merrier, but at least 2 liters would be better. For general health maintenance, we would want at least 1 to 1.5 liters. It can help in sleep issues. It can help in weight management. It can help in diabetes, especially diabetes. It can help in arthritis. It's a thing because body produces oxidative reactive oxidative species, and as soon as it goes, it signals and it directly starts neutralizing. So it will help in almost all disease models. And these are some of the studies which are there. You can just go to hydrogenstudies.com. There are almost more than 1,300 studies. I think so they have updated it to almost 1,700 studies, which show about protective effects of hydrogen on radiation-induced bone marrow damage, effect of hydrogen therapy on hearing loss of patients with carcinoma after radiotherapy. Hydrogen gas activates coenzyme Q10 to restore exhausted CD8 plus T cells, and various other things that are damaging to the body. And also, there are studies how it can halt the tumor progression and various other things. I've just written down a few of the things. I've given a brief background on how hydrogen works in the body and how it can help in various disease models and especially cancer. Here we have our hydrogen machines at thrivingwater.com. You can check out. If you have any questions, you can just call me up on any questions regarding hydrogen. If you have any questions, we can go for questions. There is.
All right. Thank you so much, Praveen. There are a lot of questions, so I'll try to pick a few and answer. That was very informative. So, all right, let me start with few questions. So, people are asking about the ppm of water, and what dosage of ppm in hydrogen water will be good. So, can you talk about that?
So, its ppm is what they recommend is the physical hydrogen that is needed. Like 1 ppm is nothing but it's 10 mg of hydrogen consumption, like 1 mg of hydrogen consumption. So what is recommended and what is seen as effective is at least try to get at least 1 ppm hydrogen concentration. The more the better, but at least 1 ppm would be a way to go forward. And the machines which we have produce at least 1 ppm. The kettles and the bottles which are there, they produce at least around 3 to 3.5 ppm. So you just need to pour water in it, press the button, the hydrogen gas gets infused in the water. Whatever the toxins, like the byproducts like ozone, like chlorine and oxygen are thrown out, and there is only hydrogen in it. And it's best to drink only hydrogen water, because you generally get a higher dose of hydrogen. If it is a hydrogen and oxygen mix, you generally get a lower dose of hydrogen. So at least 1 ppm, and you can go up to 4 ppm, 5 ppm. There are ways, there are tablets which come. They're called, so magnesium malate. If at all it is put in water, it basically produces hydrogen gas, and that gets dissolved. There are tablets like this, you can use that produce up to 10 ppm. but they're not necessary. And it's like you have to continuously refill. Hydrogen like machines are a very nice alternative, and they last longer time, and you can drink it daily.
So yeah, so just I have the hydrogen. I don't know if people can see it. I have the hydrogen bottle, and it's very simple. You can just keep it on your desk, and whenever you want it, you can just turn it on and make hydrogen water. So that's really simple. All right. So how do we test if if the water is hydrogenated? Is there a way
Uh,
to test
Yeah, so testing, there is a chromatography, which is the standard testing, but they are very huge machines. But there is something called as, uh, like I don't have it right now in my hand. Uh, there is a blue color liquid which you get. It's a dye. We don't know. It's a mixture of different dyes.
Yes.
If you put in hydrogen water, it starts dissolve. You basically get to know the concentration of hydrogen by just putting a drop of it. There's a way to test it. Um, yeah, that's the standard test which can be used. They're not available in India. You can definitely find them in US. We are planning to get them in larger quantities so that we make sure whatever machines we have, we test them beforehand. So once that we can, like, each drop of it is corresponding to zero point 0.1 ppm of hydrogen. You just have to take 3 ml of hydrogen water, like whatever water you want to test, and you can just put a drop of that liquid, and it will start. As soon as there is a decoloration of that liquid, those that much equivalent of ppm of hydrogen is present in that liquid. So that's a testing method. And yeah, we'll try to make it available soon. But as of now, we ourselves test it every time we are sending out the machines. That's the best way. No amount of testing the pH or ORPs or those things are going to give you the exact hydrogen concentration, because what they do, like if you have a hydrogen testing like there is a small machine like a meter which is same as ORP meter. What they do is they check the ORP, and the ORP, the corresponding ORP which is seen to be equivalent of hydrogen is given out. But that's not the way to test. ORP can be increased just by anything and everything, and especially pH can be increased by just adding salts. So it's not about the pH. So you might have heard of Kangen water or various these machines which are big machines. There they say it's alkaline water. I can make alkaline water by just adding sodium bicarbonate. I don't need anything else. And sodium bicarbonate is anyways produced in the body by pancreas for neutralizing our stomach acids. So it's not the it's not the alkalinity of the water that is helping. It's the electrolysis process which produces the hydrogen gas, and the ORP which is tested in the hydrogen, like in that water, is because of the free H plus ions that are produced in the process. So if it is kept for a longer time, that's one. And also the hydrogen gas also evaporates, so we will not be able to see any reading on the ORP meters. But ORP meter is not a reading to go with. It needs to be by the liquid we have. So,
Okay. So,
if you,
and there are some questions about how can hydrogen water help in autism or anxiety, depression, etc.
so like autism is a it's a neurotransmitter imbalance, especially glutamate excitotoxicity. When there is any toxicity, there is a byproduct that which are reactive oxidative species, and it's a imbalance because of various things which we have talked before, like it may be toxins or various other things, pathogens. Now, as long as that imbalance is there, there is a excitotoxicity, and as long that is there, the brain is on fire, you can say. And as soon as you drink hydrogen water, there is one signaling that happens, which starts this NRF2 pathways and various pathways which start producing the antioxidant. By itself, hydrogen can pass through the blood-brain barrier and starts neutralizing these. And it will start becoming the kind of a protective layer if there is any oxidative stress, because of which there can be a reduction in oxidative stress, and which helps in further repairing of the brain, we can say, uh, and whatever necessary things that are needed for the body to heal, that can happen.
So, an
And it is
individual,
sorry, yes.
yeah, please go ahead.
And it's the
Go
same
ahead.
with dementia or Alzheimer's. It may not have like even Parkinson's, but Parkinson's is not an excitotoxicity. It is a GABA, excessive GABA disease, wherein the action happens in a very different manner. Hydrogen is a regulator, we can say. If there is something like you might know about GABA and glutamates. So there has to be a balance. Glutamates gets converted to GABA, and again there is a reversal of to glutamate. So if there is a glutamate excitotoxicity, we want it converted to GABA or whatever damages that can happen. We want that to reduce. If there is a higher GABA like a Parkinson's, then there is a signaling molecule which will start reducing these GABA. So any neurological issues, generally, if at all, consumption of water, like hydrogen water, is seen to basically balance them. It's a regulator.
Okay. And can an individual drink only drink hydrogen water during the entire day?
Yes, definitely. They can only drink hydrogen water on a daily basis all the time. Initially, you may have to go slow because it can start doing you may get detox reactions because the liver starts getting better and you may start feeling light and I think go slow and then you can go to the full the complete day consumption with hydrogen water. But yeah, it's always better to start slowly.
I can already see someone sharing that it's helping their child with the gut issues. Um, all right. So great. So thank you so much, Praveen. I think it was very useful and very new information also for our audience here. So thank you so much for your time.
Thanks.
Let me just see if there's any further question. Uh, no, I think we've covered all. All right. Thank you so much. Thank you.
Yeah, thank you. Thanks a lot.
So, thank you. So I hope all of you found today's short sessions interesting and useful. We try to cover most of the questions that were there in the chat. If there's still any information that you're looking for regarding the two sessions that we had, please ask the admins in the WhatsApp community. We have shared details about hydrogen water in the chat, the websites, etc. We have also shared information about peptides. If there's anything else you would like to know, please reach out to the admins in the WhatsApp community. With that, we will wrap up today's post-conference bonus sessions. Thank you all of you for your participation. We will be coming up with some more interesting, exciting sessions in the new year. So please stay tuned with that. If you're not yet following our social media handles of IFM, please do that so that you're aware of our upcoming sessions, webinars, workshops, etc. And a reminder to few practitioners here who are practicing functional medicine or integrative medicine, or you're a functional nutritionist or a coach. We have our membership details shared. You can become an IFM member and be a part of many other activities that we do at IFM. So please check the details of the IFM membership as well. That's all from my end. And happy holidays, everyone. And hope all of you have a good start of 2025. Thank you so much.